In today's class, let us learn about alopecia areata. So today we will discuss some basic concepts about alopecia areata, what is alopecia, and their clinical presentations, different types of alopecia, and how alopecia is treated in the hospital. So let's begin our session. See, let me tell you some basic concepts about hair growth. Okay, one thing you have to remember that we have 5 million hair follicles in our body. Okay, we have 5 million hair follicles in our body, and among these 5 million hair follicles we have 0.5 million hair follicles on scalp. Out of 5 million hair follicles all over the body, 0.5 million hair follicles are present on scalp. Let me tell some more basic points about hair follicles and hair growth in our body. See, our hair grows continuously in cyclic manner. It continuously, hair will be growing in cyclic manner. Okay, let me tell you, it exhibits 4 phases. In that the first phase is called anagen. Anagen means hair starts growing. Okay, that is called growth. This is the first phase of continuous hair growth, that is called anagen. In this phase, hair starts growing from the follicle. Okay, from the follicle hair starts growing. This is called growth phase. And second is catagen phase. This phase is called regression phase. Okay, once the hair grows, it will stop its growth. Okay, this is called regression phase. And third one is telogen phase. In this phase, the hairs will rest. It's called resting phase. The already grown hairs will be at resting position. They will not grow further. And fourth phase is called exogen phase. In this phase, the hairs will shed off. The already grown hairs will try to shed off. And after shedding again, the first phase will start, anagen. So after shedding, first phase will start, anagen, and then catagen, and after catagen, telogen, and again after telogen, exogen. Hairs will start growing, it will regress, and it will rest for some time, and it will shed. After shedding again, hair will start growing. So like this, hairs will grow up to 30 cycles in our life. Up to 30 cycles it will grow. And here, among all these phases, telogen phase is the lengthy phase. Okay, telogen phase, resting phase is lengthy phase. So in our body, these hairs will grow up to 30 cycles. This one is basic point. And let me tell you, alopecia is nothing but loss of hair. And alopecia areata means loss of hair at particular patches or a particular area. I'll try to tell you all the types of alopecia areata and alopecia, different types of alopecias. You have to remember the different phases of hair growth. Okay, now here you have to remember one thing. Alopecia areata is the condition which is characterized by sudden or rapid appearance of circumscribed or circular or oval bald patches in hair bearing areas, especially scalp. In simple terms, alopecia is nothing but loss of hair. Alopecia areata means loss of hair at particular patches, at particular areas. Okay, so this alopecia can result due to 2 cases. Alopecia can be caused due to 2 reasons. You have to remember very carefully, listen carefully here. Alopecia can be caused due to 2 reasons. Number 1, if patient has defect in hair cycle. Just now we discussed. See, these are 4 phases in the hair cycle. If this hair cycle is defected, or if any defects are seen in these 4 phases, then it may lead to alopecia. The first reason for alopecia is defect in the hair cycle, and second reason for alopecia is destruction of hair follicle. Destruction of hair follicle will lead to alopecia, which is loss of hair. This is second reason. First reason is defect in the hair cycle. Second reason is destruction of hair follicle. So these are two main reasons for alopecia. Alopecia means hair loss. I think you understood the definition and two main causes for alopecia. And you have to remember some more basic points here. Sometimes hairs will grow in excess. Excess growth of hair is called hirsutism. In previous classes we already discussed hirsutism is excess growth of hair. This hirsutism can be seen due to some adverse effects, due to some drugs. There is a very famous drug called phenytoin. Phenytoin can cause hirsutism, excess growth of hair on the body or on the scalp or anywhere on the body is called hirsutism. If limited growth of hair or sparse growth of hair or limited growth of hair, sparse growth of hair or limited growth of hair is called hypotrichosis. This hirsutism also can be termed as hypertrichosis. Hypertrichosis means excess growth of hair, and sparse growth of hair or limited growth of hair is called hypotrichosis. You have to remember these two terms. And there are, apart from phenytoin, there are many other drugs. They can cause hirsutism, overgrowth of hair. So these are two important points you have to remember. Now let's talk about epidemiology. Epidemiology data of alopecia. It can occur at any age. First thing, alopecia can occur at any age. Alopecia areata can be seen at any age, but the highest susceptibility of alopecia areata can be seen between the ages of 15 to 29. I am not talking about the alopecia which is seen due to bald head, okay? That is androgenic bald head, that is different. I am talking about alopecia areata, which is a autoimmune disorder. Alopecia areata is a autoimmune disorder. Most of the times it is a autoimmune disorder. Okay, so alopecia areata, more susceptibility is seen between the patients between the ages of 15 to 29. Okay, and approximately the prevalence rate of general population is 0.1 to 0.2. And alopecia areata can be seen with the patients who are already having family history, and as I told, it is seen between 15 to 29 years. Highest susceptibility is between 15 to 29 years. It can occur at any age. Okay, and these are some basic points about epidemiology. Let us see pathophysiology of alopecia areata. Alopecia areata, usually here, as I told, this destruction of hair follicle is seen due to T cell mediated immunity. Okay, actually T lymphocytes will mediate cell mediated immunity. This cell mediated immunity will produce some CD4 cells. These CD4 cells will go and it will attack the follicles and it will try to degrade or destroy the hair follicles. Actually, this T cell mediated immunity will produce some macrophages. These macrophages are actually, they are immune cells which will try to destroy the cancer cells or some infected cells to remove from the body. Here the T cell mediated immunity, the T cells, these macrophages will wrongly, they will understand, they will recognize, wrongly they will interpret that these follicles are foreign particles, and due to that what happens, this T cell mediated cell immunity will destroy the follicles, and with that it will cause alopecia. So alopecia is a cell mediated immunity. Actually we have humoral immunity, which is a B cell mediated immunity. Actually B cells will produce antibodies, and T cells will produce CD4 cells, which is called cell mediated immunity. You have to remember this point. Now alopecia also can be seen due to environmental and lifestyle changes. There are so many other causes for that. Usually the alopecia is associated, it is alopecia is associated with certain disease conditions. Since it is a autoimmune, alopecia is most of the time it is an autoimmune disease. It is associated with some other disease conditions, like it is associated with type 1 diabetes, it is associated with atopy, it is associated with autoimmune thyroid disease, it is associated with polyendocrinopathy, it is associated with vitiligo. Vitiligo is also another autoimmune disorder, and sometimes pernicious anemia. It is associated with pernicious anemia. It is associated with inflammatory bowel disease and Down's syndrome. If anybody has type 1 diabetes, they may have alopecia, because alopecia is associated with these many conditions. But it is not that everybody who are having these disease conditions will have alopecia, but most of the time alopecia is associated with diabetes 1, atopy, autoimmune thyroid disorder, polyendocrinopathy, vitiligo, pernicious anemia, inflammatory bowel disease and Down's syndrome. These are different conditions by which this alopecia is associated. Okay, so let us see some clinical presentations of alopecia. Alopecia, mainly it starts with solitary patch, mainly it starts with a single patch in 80% of cases. Okay, and presence of exclamation mark on the hair, you have to remember this. So you can see the hair with exclamatory mark, this type of hairs, the exclamatory mark type of hairs. Okay, this type of hairs are usually seen in patients with alopecia. So this is one main clinical presentation. And regrowth in alopecia areata patches commences from the center and progresses centrifugally. Usually from the center the hair starts growing, and from center it will be progressing peripherally. Okay, the regrowth of hairs, that you have to remember. And some other clinical presentations you have to remember. See, by seeing the different types of alopecia areata, remember, based on their structure and based on their size and based on the severity, and based on structure and based on different types of patches, alopecia is differentiated, classified into different types. So see, you can see the first one, it is called focal alopecia areata. Focal alopecia areata is the type of alopecia areata where a single patch is seen on the scalp or on the beard, usually on the scalp. This is called focal type of alopecia areata. Sometimes different patches or various patches are seen on the body or on the scalp. This type of alopecia is called reticular alopecia areata. This type of alopecia is called reticular alopecia areata. And you can see this type of alopecia areata is ophiasis. You can see ophiasis. Actually, ophiasis type of alopecia areata is seen at the margins or on the peripheral areas of the scalp. They are present on the peripheral areas or margins of the scalp. This type of alopecia areata is called ophiasis. And there is one more type of alopecia areata which is usually a male pattern baldness, we call it. It is called Sciaffo alopecia areata. It is called Sciaffo alopecia areata. You can see it is called male pattern baldness. Okay, and sometimes the alopecia is seen on the scalp, total scalp. You can see here, total scalp is removed with the hair. That is called alopecia totalis. Alopecia totalis is the condition where total scalp or total tissue is removed with the hair. Total tissue or total scalp is absent with hair. That is called alopecia totalis. And sometimes there is a condition called alopecia universalis. Total body will not have any hair. Total body has no hair. That is called alopecia universalis. So these are different types of alopecia based on the severity and based on the shape and structure and types of alopecias. Okay, these are different types. Now let us see, there is one more type of alopecia which is involved on the nails. Okay, you can see here, see, based on the distribution and based on severity, several clinical patterns are recognized. One is focal, as I told, a single patch is present on the skull. Sometimes reticular, multiple patches are seen on the scalp. Ophiasis, these type of alopecia is seen in occipital and temporal scalp. You can see here in the occipital areas, on the occipital areas and on the borders of the scalp. Okay, and Sissypho type of alopecia areata, Sissypho type of alopecia areata is a type of baldness. It is a male pattern baldness. Okay, and in alopecia totalis, total scalp is having loss of hair. Alopecia universalis, loss of hair all over the body along with scalp and total body is absent with the hairs. That is called alopecia universalis. And sometimes nail involvement also can be seen, which is usually a pitting type. That is one type of autoimmune disorder which is associated with alopecia areata. Now let us see the management of alopecia areata. Usually the topical steroids are very effective for alopecia areata. Sometimes intralesional steroids are given in some patients. In the lesions or in the patches, some injections were injected at the site of alopecia. Usually triamcinolone, which is a corticosteroid, which is very effective, and most of the time 5% minoxidil lotion or solution is available and solution is available, which is also another effective drug for alopecia. And along with this, there is a very important systemic tablet which is called levamisole. Levamisole is another type of drug. It is a drug which is usually comes in 50 to 150 mg. It is given for 2 consecutive days in a week, and this is given for 3 to 6 months for active alopecia areata patients. Okay, this is another type of drug. Actually, it is a antiparasitic drug. This drug has immunomodulating activity as well, for which it is very effective. And sometimes prednisolone, which is available in oral form as mini pulse, usually 0.5 mg per kg dose is given for 2 consecutive mornings in a week, 2 continuous 2 days in a week, which is given as mini pulse. Okay, so such type of treatments will decrease the adverse effects and which are very effective for treating alopecia areata. So this is the another strategy. Always remember, alopecia areata is treated with topical steroids and sometimes intralesional steroid injections are given. Along with that, 5% minoxidil lotion or solution is very effective. Sometimes for active spreading alopecia areata, levamisole tablet 50 to 150 mg and prednisolone tablet as mini pulse. Okay, these 5 strategies are very effective. Let me revise the total alopecia areata concept. As we already know, there are 5 million hair follicles are present all over the body, and among them 0.5 million hair follicles are located on the scalp. Okay, and hair usually grows continuously in the body, and it is having 4 phases. Among them, among the 4 phases, anagen, catagen, telogen and exogen. So these are 4 phases. Once exogen completes, again anagen will start, and such type of phases, we have 30 phases in our body. And always remember, alopecia areata is treated with topical steroids, and in topical steroids we have corticosteroids. It is a very important strategy for alopecia areata. And sometimes intralesional injections were available as very effective therapy for alopecia areata. And along with this 5% minoxidil solution is very effective, and sometimes levamisole tablets and systemic corticosteroids like prednisolone is effective. So these are different treatment strategies for alopecia areata. Okay, I think you learned something from our video. Please don't forget to subscribe our channel and share with your friends. I'll come with some other videos, very interesting concepts. Keep watching our previous videos as well. Thank you.